Welcome to our video on the 8 common signs of diabetes on the skin. Elevated blood sugar levels, a symptom of diabetes, can have serious effects on the body. Often, it's not just internal symptoms that alert an individual to the possibility of this metabolic disorder. The skin too can present visible signs. These skin changes can sometimes even be the first clue that someone has diabetes or that their diabetes isn't well controlled. Before we start our countdown, please don't forget to give this video a thumbs up and subscribe to our channel to help us reach more people. And ring the notification bell so you can be the first to know when our latest video comes out. Now, let's uncover 8 common skin signs linked to diabetes, starting with number 8, acanthosis nigricans. Acanthosis nigricans AN is more than just a skin condition. It's a signal from your body about deeper metabolic processes. Manifesting as velvety, dark patches on the skin, these patches often look as if they've been painted or smudged onto the body. Found predominantly in the body's natural folds, such as the neck, armpits, and groin, they can sometimes appear on the elbows, knees, knuckles, and even the face. The exact cause of AN is still being studied, but it's largely believed to be linked with insulin resistance. Insulin is a hormone that our body produces to help cells absorb glucose from the bloodstream. When the body starts producing more insulin to overcome resistance, it can lead to an accelerated growth of skin cells and, subsequently, the darkened patches characteristic of AN. Now, while acanthosis nigricans can be found in individuals of all ages, it's especially concerning in younger individuals as it might be an early indicator of type 2 diabetes. Apart from diabetes, it's also seen in association with obesity and hormonal disorders. It's essential to understand that acanthosis nigricans itself isn't harmful or contagious, but it's a visual clue to underlying health concerns. While cosmetic treatments can help in reducing its appearance, the primary approach should be addressing the root causes like improving diet, losing weight, or managing blood sugar levels to truly alleviate the condition. Now we come to number 7, diabetic dermopathy. Diabetic dermopathy, sometimes colloquially referred to as shin spots or diabetic skin spots, often appears on the shins, hence the nickname. At first glance, they might resemble age spots or even simple discolorations, leading many to overlook them. They manifest as light brown, round, or oval patches, often with a scaly texture. The exact cause behind diabetic dermopathy remains somewhat elusive. However, experts believe they emerge due to changes in the small blood vessels under the skin. As diabetes can cause complications in blood circulation and potentially damage blood vessels, these skin changes can be seen as a direct consequence of such vascular issues. One reassuring aspect of diabetic dermopathy is that the patches themselves aren't painful or itchy. They are, in essence, harmless. However, their presence might be telling a more profound story about one's overall vascular health, especially in relation to diabetes. While the patches can fade over time, they might not disappear completely. Yet, they serve as a tangible reminder of the importance of monitoring and managing one's blood sugar and overall health, given the systemic impacts of diabetes on various bodily functions. Sliding down our list to number 6 are diabetic blisters. The world of diabetes, unfortunately, holds many surprises, and diabetic blisters or bullosis diabeticorum are among its more mysterious manifestations. These blisters closely resemble those you might get from a burn or severe friction. They can vary in size, ranging from quite small to larger than a couple of inches. The intriguing part? Despite their daunting appearance, these blisters are often painless. Though anyone with diabetes can develop these blisters, they're more commonly found in people who have diabetic neuropathy, nerve damage. However, not everyone with this nerve damage will have blisters. You'll often find these blisters on the hands, feet, legs, or arms. They can pop up without warning, but usually go away on their own in a few weeks. While they aren't usually harmful, they hint that someone might need to manage their diabetes better. If you notice these blisters, keep them clean to avoid infections, especially since people with diabetes can get infections more easily. At number 5, we have Necrobiosis lipoitica diabeticorum, NLD. NLD, or Necrobiosis lipoitica diabeticorum, is a skin issue that's often connected to diabetes. But what causes it? Scientists are still piecing that puzzle together. One theory is that it's linked to how blood moves in our body. When someone has diabetes, blood flow can change, and this might be a trigger for NLD. So, what does NLD look like? Well, remember the brown patches we talked about earlier, known as diabetic dermopathy? NLD can appear somewhat like those, but with some key differences. The spots from NLD are generally larger and go deeper into the skin. Over time, they can change in appearance. The center of these patches often gets shiny and they can turn a reddish-brown color. Sometimes, you might also see a purple or violet ring around them. Most of the time, these patches are quiet and painless. But as they grow or change, they can become itchy, and for some people, they can even hurt. It's essential to keep an eye on them. If they're not treated or if they're irritated, they can break open, leading to sores. Here's an interesting thing. While NLD is common in people with diabetes, it can also pop up in people who don't have diabetes. If someone notices these patches and hasn't been diagnosed with diabetes, it might be a good idea to see a doctor. These spots could be a sign that it's time for a health check. Claiming the 4th spot is digital sclerosis. Your skin can sometimes show signs of what's going on inside your body. A good example is digital sclerosis, a condition often seen in people with type 1 diabetes. The name sounds fancy, but it simply means hard skin. So, what does this look like? It's when the skin, usually on the back of the hands and feet, gets thick and tight, almost like an old rubber band that's lost its stretch. This isn't just about how the skin looks. If the skin gets too tight, especially on the hands, it can be hard to bend the fingers. It's like trying to bend a stiff garden hose. We're still learning why this happens, but it's related to type 1 diabetes. Keeping blood sugar in check can help the skin feel softer. People with this skin issue should also keep their skin moisturized to prevent it from cracking, which could lead to infections. If you or someone you know has these skin changes and type 1 diabetes, it's a good idea to talk to a doctor. Getting help early can prevent more issues and help keep the skin healthy. Securing the 3rd spot on our list is skin infections. The human skin, our body's largest organ, acts as a primary barrier, protecting our internal systems from the external environment. But what happens when this barrier's integrity is compromised? Diabetes, with its fluctuating blood sugar levels, can inadvertently create a favorable environment for infections. For people with diabetes, the story often goes deeper than just elevated sugar levels in the blood. These sugar spikes can also lead to higher levels of sugar in the sweat, which, in turn, can make the skin a breeding ground for bacteria and fungi. Additionally, high blood glucose levels can weaken the immune system's efficiency, making it harder for the body to ward off these invading microbes. Among the most frequent offenders on the fungal side are conditions like jock itch, tinea cruris, ringworm, tinea corporis, and athlete's foot, tinea pedis. These are characterized by itching, redness, and often a ring-like rash. The moist and warm areas of the body become prime real estate for these fungi to thrive. On the bacterial front, those with diabetes might find themselves grappling with conditions like boils, painful, pus-filled bumps under the skin, styes, infections around the eyelids, and even nail infections. High blood sugar provides an ample supply of nutrients for bacteria, allowing them to proliferate rapidly. Recognizing these infections early is key. Look out for persistent redness, swelling, warmth, or pain. Keeping the skin clean and dry, particularly in areas prone to moisture like the feet, armpits, and groin, can be an effective preventive measure. Moreover, managing blood sugar effectively not only decreases the risk of skin infections, but also ensures a robust response should one occur. If you observe any signs of a skin infection, especially if you have diabetes, it's crucial to seek medical advice promptly. Timely treatment can make all the difference, preventing complications and ensuring skin remains healthy and vibrant. Taking the spot at number 2 is yellow skin. In the world of diabetes, skin problems, there's one that's hard to miss. Tiny yellow bumps that might remind you of peas. They have a fancy name, eruptive xanthomatosis. It's a way your body shows that something's off balance inside. You know how our blood has fats, right? One kind is called triglycerides. When someone's diabetes isn't in check, these fats can pile up. And when there's too much, these yellow bumps show up. These bumps aren't just yellow, they have a reddish ring around them, making them look a bit dramatic. And guess what? They can be itchy too. You'll often find them on places like the bottom, thighs, inside of the elbows, or behind the knees. Now, what are these bumps made of? They're basically pockets of cholesterol. It's like when there's a traffic jam of fats in the blood, some decide to park in the skin. Seeing these bumps is like your body's alarm bell. It's saying, hey, we need to check on our blood sugars and fats. It's a reminder of how everything in our body is linked. So, if you spot these yellow bumps, especially if you know diabetes is in the picture, it's time to chat with a doctor. Sorting out the main problem, usually by getting diabetes and fats under control, will help these bumps go away. Plus, a doctor might give them something for the itch to help them heal faster. Finally, securing the top spot on our list at number 1 is peripheral neuropathy. At first glance, peripheral neuropathy may seem out of place on a list of skin changes. After all, it primarily affects the nerves. However, the indirect effects of this condition play a monumental role in the skin health of diabetics. Diabetes can be likened to an iceberg. What's visible, like high blood sugar levels, is just a part of the story. Below the surface lies a cascade of complications, and peripheral neuropathy is one of its most insidious manifestations. This condition is characterized by damage to the nerves that transmit signals between the extremities and the brain. As these nerves become impaired, they lead to sensations of numbness, tingling, or even burning, primarily affecting the feet and, to a lesser extent, the hands. The danger of numbness cannot be overstated. Imagine stepping on a sharp object or developing a blister and not feeling it. Or consider the risks of excessively hot bathwater causing a burn without any immediate pain as an alert. These scenarios can and do happen to people with advanced peripheral neuropathy. Such injuries, if unnoticed and therefore untreated, can escalate. The compromised blood flow and immune response in diabetics can mean that these wounds become ulcers. These ulcers are not just mere skin issues, they can become gateways for infections, posing severe health risks. Adding to the complication is the fact that high blood sugar levels can slow the skin's healing process, making these ulcers persistent and challenging to treat. If left unchecked, the worst cases might even lead to severe infections requiring amputation. The story of peripheral neuropathy underscores the importance of regular foot checks for diabetics. It's not just about looking for visible signs of damage, but also about ensuring that the sensation in the feet remains intact. And there you have it, 8 common signs of diabetes on the skin. While diabetes is fundamentally an internal metabolic disorder, its effects are not just hidden beneath the skin. Recognizing these skin signs early can pave the way for timely diagnosis and management. But remember, skin changes should always be discussed with a dermatologist or primary care physician to get an accurate diagnosis. If this information has shed light on a crucial health topic, please give us a thumbs up and share this video. Every share could potentially guide someone towards better health. And don't forget to subscribe for more insightful content. Stay aware and stay healthy.